So, what's happening, guys and gals? It's it's Jamil Turan and the legendary Dr. Nicholas Downey is again with us. Thank God. He's always welcome. Welcome to show.
Thank you
So,
for having me, Jimmy.
yeah, you're welcome. Today we are going to talk about brain health, estrogen to newer generation calcium channel blockers and androgen families, and last but not least, my favorite part, the fun part. And I'm 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 going to ask my fun questions in the end of the podcast. So the brain health is very important, but most bodybuilders or like people who lift weights for fun. What we call them? We call them
Gym rats?
yeah, we can call them gym rats. Like they mostly think they're like liver health, and recently they just realized that liver is not the only organ that get affected by steroids and androgens. So they recently realized that heart and kidneys are also important, but they neglect their brain health. So what they can do for maintaining their brain health, and also for at the same time, if it's possible, how can they improve their brain health when they steroid when they are using steroid, of course.
I mean, yeah, that this is an interesting topic. I haven't covered it so often on my channel because it requires like a lot of psychiatric principles and things like that. But yeah, as you say, there are a ton of different research, especially in Winstrol and Deca or nandrolone and stanozolol, showing that those are quite damaging to our monoaminergic system, with all those monoamine neurotransmitters such as your serotonins, your dopamines, your noradrenalines,
Yeah,
and whatnot.
nandrolone family androgens
Oh,
are
and 19
notorious,
more,
and
yeah.
progestins are notorious for uh, negatively influencing your brain health, like
Exactly.
increased beta amyloid content. For those who don't know,
Yeah,
beta amyloid just basically made of aggregated unfolding protein, misfolded proteins. So it's highly associated with Alzheimer's disease. Am I correct so far?
yeah. I
Yeah.
mean, that's the prevailing theory. They still don't know what Alzheimer's is, but yeah, it's the beta amyloid hypothesis. That's what we go on, and that's what we think. So most of the treatment would be aimed at correcting that. As you mentioned, 19 mores are not so safe when it comes to beta amyloid and things like that.
So I recently found out that when I was researching how how much different 19 node derivatives were, they how much different their effect on brain health was. And I realized that Dianabol was actually quite toxic for brain, if not as much as
That's interesting.
19 or testosterone, because I've seen research that they couldn't prevent beta amyloid accumulation in brain even when they block androgen receptor. So probably that might be for the estrogen, like estrogen, like 17, the metal estrogen created by Dianabol might cause ne- negative health outcomes in brain.
So
So that
I
might
mean,
be a
this
reason.
is like interesting theories that, I mean, it's all molecular science and things like
Yeah,
that, and is yet to be proven. But what we what's interesting to note is, especially with the 17 alpha methyl estradiol, we have different estrogen receptors, especially within our brain, such as your estrogen receptor alpha and beta. And the problem is, from what I'm aware of, is that either it's 17 alpha methyl estradiol seems to prefer estrogen receptor alpha over estrogen receptor beta. So it almost, if the only estrogen you have in your system, since if you're using Dianabol, you're shutting down your natural testosterone, so you don't have your normal estradiol, then you have the 17, I won't say it, but the Dianabol estrogen, which you also get when using Trestolone or Ment. And this
It's
estrogen doesn't
technically
seem
not
to,
exactly the same, but quite similar.
okay, okay, the whatever they're called, they seem to um, preferentially bind onto ER alpha as opposed to estrogen receptor beta. And the thing with estrogen receptor beta is that is responsible for, well, they found that it's linked to beta amyloid regulation within the brain, which is why possibly Dianabol might have its adverse effects. I don't know. I just kind of thought about that when you mentioned it. And yeah, it would be interesting to research because of how important this estrogen receptor beta is, especially in relation to brain health. And it's also involved in the development of cretinism. So babies who are born with an atrophic thyroid seem to lack brain development and seem to be mentally, I don't
Borderline
know the
retarded,
correct
are
word.
they?
Yeah. So yeah, they're called cretins, which isn't politically correct, I don't think. And the reason for that is not only the lack of TSH, but they found that there are a lack of estrogen receptor betas. So that was just interesting to know. But you were saying Ment doesn't convert to 17 alpha methyl estradiol. I'm just interested to hear
Yeah, it's like 7 alpha methyl estradiol.
7 alpha. Oh, is it 7, not 17?
Yeah, 7 alpha.
Okay.
And the aromatization of the 19 nor families is actually a bit funny because you can see that some progestin is used in birth controls, like gonane family.
Yeah.
They seem to aromatize when you ingest orally. So in liver, they can aromatize, but when you inject it, they don't seem to aromatize that much, or they barely aromatize. The same thing can go for the simple nandrolone, 19-nortestosterone, because we know that in animals, in cattle, 19-nortestosterone aromatizes to 17 beta estradiol because it's been speculated that proposed mechanism of the creation of nandrolone is via aromatization pathway. Like some of the uh, metabolites cannot go completely converted to estradiol. Some of them become somehow escaped, and here you go. You have 19-nortestosterone. So it seems like in humans, like the rate of conversion is very minimal. The same thing probably applies for the 7 alpha methyl 19-nortestosterone, aka trastolone.
Yeah.
I've seen that some progestins developed for male contraception, male birth control. As you probably know, trastolone was also developed for male contraception too.
Yeah.
But they seem like they don't aromatize with human aromatase enzyme whatsoever. So the aromatization, the lack of methyl group at 19th position seems to negatively affect the interaction with aromatase. So the aromatization part gets a bit tricky, actually. So, but we also, at the same time, we know that the trastolone is gets converted to estradiol very inefficiently. It barely gets converted, but when it gets converted, the 7 alpha methyl 19 7 alpha methyl estradiol is quite potent, but also it's a quite strong, quite effective progestin. So the notorious water weight people talk about, notorious
Okay.
water weight they gain might also be coming from the progestinic effect, like progestin prolactin complex. That's my take. So can ACE inhibitors and ARBs prevent the negative effect of steroids on brain health? Can they help to mitigate those negative effects?
I would be unsure of that. I haven't done too much research into that in particular, but it is there's definitely is a relation between brain health and things like that and aldosterone, because aldosterone does seem to impact the brain in some way, but I do not know enough to say.
Yeah, it's quite tricky to get it because uh, like aldosterone's negative influence on health does not only come from sodium retention, even the absence of the excess sodium retention.
Yes.
It seems
Yeah.
like it increases the like focal glomerular sclerosis in kidney, like deposition of
Yes.
extracellular
Yes.
matrix contents. It seems to increase, and it seems to increase the. So basically, you develop kidney disease faster with higher aldosterone.
Yes. Yeah. Yeah. That is that's probably one of the worst effects of aldosterone. Well, one of the worst. But yeah, that's definitely yeah, it's definitely not just salt retention that you need to worry about.
Would you prefer would you advise someone to use like more lipophilic ARBs for prevention of brain damage,
Well,
so-called damage?
I yeah, I suppose. Well, I don't know. I'd have to look at the studies, but mechanistically that would make more sense, because how else is it going to get into the circulation of the brain through the blood-brain barrier if it's not lipophilic? Um, so yeah, definitely would make more sense, but I'm not sure in clinical practice what the outcome is. But it would be interesting to see. If you
Yeah,
do
in
know, uh,
in dementia patients, like telmisartan seems to be the most effective drug for cognitive health. Like they almost some studies show that acutely they improve the cognitive functions, and most of them seem to like there seems to be a consensus that shows telmisartan stops the development of uh, dementia, at least acutely.
okay.
So very
Um,
little to no studies show that it had no effect whatsoever. Most of them show very effective, uh, very effective results. Very
and
promising drug. And also
what was
interesting.
their,
Please go ahead.
sorry, I was just going to ask him, what was their theory behind its, uh, behind the reason that it seems to aid in dementia,
The
and which type of dementia?
PPAR agonism seems to increase the beneficial effect. Like there's a synergy between like AT1 receptor blockade with PPAR agonism. And also
Interesting.
interesting thing is, if you look at the telmisartan, it has the
Mhm.
highest lipophilicity among the ARBs, and
Yes. Oh,
it
so it
has
has the
the
highest
only
volume distribution.
it has the only uh, ARB that has PPAR PPAR agonism. But if you take a look at other ARBs, you see that there are basically two other ARBs that also have PPAR agonism, but not in the clinical dosings, like 100 or 1,000 times higher than the clinical dose. But the first place, the last place, the highest to lowest lipophilicity, the second to third place for PPAR gamma activity also shares the second to third place for the lipophilicity. So I think that there's quite high correlation between lipophilicity and PPAR agonism.
Yeah, I'd suggest that was the case due to how PPAR agonism works. I assume it would be lipophilic dependent, but
yeah, in order to get PPAR activity, it has to be somewhat lipophilic in order to get into cell and interact with the cell nucleus, right?
Exactly. Yeah, and to cause the whole cascade of nuclear transcription and translation and what have it. But yeah, that's very interesting. So did they mention what type of dementia it aided in? Was it just Alzheimer's dementia or vascular dementia? Because I would assume vascular
It
dementia,
was
but
it was I don't exactly remember whether it was a research review or meta-analysis, but it consisted of like at least 50 research for ACE inhibitors and ARBs for dementia.
okay. Well, I'm just like curious because vascular dementia is quite common nowadays due to lifestyle, and I was wondering if maybe it could help with that, but that seems to be more in relation to atherosclerosis. So, I mean, it could help in that regard, but I don't know.
So also like Alzheimer's disease is probably one of the biggest diseases that causes cognitive function decline and dementia. Like it is probably the primary disease that cause dementia, right?
Most likely. Yeah, I think it would be first and then vascular dementia second, but I'd have to check that. It's been a while since
So
I've
how can like bodybuilders like take a lesson from Alzheimer patients to prevent them getting early Alzheimer's or prevent completely getting Alzheimer's disease? How can they prevent besides like using ACE inhibitors, like and avoiding
well,
19 or testosterones in general, maybe Dianabol? Like besides that,
yes.
what can they do?
I'm not suggesting this, but there is
In
possible
theory, like
research
it's promising. We
in theory.
need to see more research about it.
Yeah, it's
It's
but in theory, um, DNP does decrease beta amyloid accumulation within the brain. But that's in theory, and DNP is quite dangerous, so don't use it. But they say microdosing it at like a dose of 4 milligrams when usually it's 2 milligrams per kg of body weight, or 2 to 7 sometimes.
They
But
have
it
one
seems
common
to,
thing, as you know, like when you use PPAR agonism, like
yeah,
you increase the uncoupling in mitochondria, so your ATP production gets less efficient. The same thing, the DMP is notorious for being a very effective chemical uncoupler, but also telmisartan seems to have slight uncoupling effects in mitochondria.
yes, I saw that and I thought that
Yeah,
was quite interesting. So everyone's harping on about how it's the best thing for weight loss, but I cannot say from this is anecdotal experience from using 40 milligrams of telmisartan daily that it's influenced my body fat percentage at all.
some people say that it actually made them harder to lose weight or make them fat. And
I
my take on it is it's probably because when you take a look at the average reduction in visceral fat and subcutaneous fat in humans, it seems like you lose more visceral fat. So when you are in a
Yes, yeah,
caloric
that's what they
deficit,
suggest.
your subcutaneous fat might become a bit harder in caloric deficit, like when dieting.
Yes, yeah, exactly. That's what they were all
Yeah.
mentioning. Or yeah, that's essentially what they mentioned. So perhaps I have less visceral fat, but definitely no change in subcutaneous fat.
So would you like to talk a bit about Trenbolone and its effects on like beta amyloid content on brain health?
Well,
I know
yeah.
you have a video about it. They can watch it also, but
Um, so essentially, I mean, it's only a study done in mice, but at the same time, it does seem to suggest that it messes around with, I forgot the name of all of the receptors and what are mobilizers of beta amyloid, but it seems to disturb this ratio. And that's the postulated theory behind how trenbolone works in beta amyloid accumulation, because there are different types of, you have like different types of beta amyloid, and I can't remember, but it seems to mess around with this ratio of
if you had a one chance to
mobilizers.
pick either nandrolone, trembolone for brain health, what would you choose?
If I had to choose one of the, so obviously, disclaimer, neither, obviously, but
Yeah.
if I
Let's
had to
say if
choose,
someone put a gun against your head and
yeah,
made you choose this one and this vial, you have to pick one.
I,
Which
I would,
would you choose?
I would, I would pick nandrolone if I had to pick one over
Yeah,
trenbolone, but not saying nandrolone's safe at all. It obviously
agreed.
is still a 19 nor, and a lot of people seem to report depression on nandrolone, which is interesting. But it has been shown in the studies that nandrolone seems to really influence that whole system with your neurotransmitters, which is also, I mean, that's
Uh,
more of a
it's
short-term problem.
multifactorial. Yeah, the lack of
Exactly.
aromatization, the progestinic activity,
So yeah, I'd have to pick
and
nandrolone.
also
And yourself?
I might create another debate that no one have ever talked, like aromatization of the 19-nor testosterone in theory seems to aromatize as same as testosterone. They both aromatize the 17 beta estradiol, but I've seen a very old research papers that show that uh, aromatized nandrolone metabolite, aka 17 beta estradiol, was not actually 17 beta estradiol. There was some metabolites that had hydrogen atom on the 19th position. Instead of, they didn't have CH3, like the
Well,
aromatase enzyme deletes the methyl group on 19th position, but there seems to be some estrogens, E2s, that have hydrogen, just H, on the 19th position.
so
So that's very
essentially,
interesting. I found it.
yeah. Um, well, in theory, this is like goes back to organic chemistry in
Yeah.
high school, but in theory, I wonder how if that methyl group has anything to do with its potency,
So
or it's just
my theory, I can say that, like, normally when testosterone has CH3 methyl group on 19th position, the aromatase basically removes it. But with nandrolone, you have already somewhat removed methyl group. You only have hydrogen, so there might be somewhat like escape route for 19-nortestosterone to become 19-norestradiol, so-called. 17-beta
I've never
estradiol
seen
with
that, but I mean, that would be
hydrogen atom
interesting.
on 19th position.
Okay.
So
It,
that was very
I mean,
interesting.
yeah, I mean, it would be interesting to see if anyone tries to study that effect
And also,
and
I
what
found
it
that with like
consequences.
injecting castrated horses with testosterone suspension, they seem to produce like metabolites of boldenone. That was very
Okay.
interesting. Like horses seem to have like endogenous metabolites of testosterone as boldenone. Boldenone seems to be one of the metabolites horses produce. Like
That's
it's in trace
interesting.
amounts, but they seem to produce that.
I mean, if that happened in us humans, that would be pretty cool.
Yeah,
Well, I mean, I guess boldenone is a testosterone derivative, so I don't even know how boldenone was made, what alteration to the testosterone structure they did in order to make boldenone. Maybe that could explain
yeah.
why horses seem to.
Can like bodybuilders prevent accumulation of beta amyloid with their estrogen? Like we know that estrogen has a big role in brain health. It has a neuroprotective effect. And also
Yes,
we
and
have
I think it's
research that show that estrogen plus trembolone combination like slow down the beta amyloid uh,
yes, yes,
the accumulation. So
yeah. Well,
should bodybuilder avoid using excessive like unnecessary aromatase inhibitors?
I mean, that would be the
Yeah.
logical, what you mean, like logical conclusion. But I'd agree with that. I think estrogen control should be moderate to mild at least. Like, don't overdo it, especially if longevity's in mind. And I suppose you could, obviously, if you're on cycle or prepping for something, that's just a short period of your time. But when you're on a cruise, try your best not to have to use AIs or anything, because the cruise is meant to bring you back to normal, essentially. So,
Like
and
as
it goes
they
in
do with their training, like they probably also should period periodize periodize
exactly.
their drug protocols. Like periodization
I think,
like is basically
um,
it's
yeah,
a
I think
basically.
what's Alex Keekle or whatever, the prep coach. I've seen some of his videos or podcasts, and he seems to mention periodizing your anabolics, essentially. And yeah, it's a interesting concept that I think competitors or athletes should utilize if they want to live until past the age of 50.
Yeah, Alex, the guy you mentioned, Alex Keekle is a really like I find him as a very smart guy in the industry because bodybuilder like bodybuilding industry so called was full of meatheads like,
Yeah.
till like 10 years ago, but nowadays we slowly see like smarter guys as with you and Alex Keekle. So
And yourself.
Alex Keekle seems to repeat a quote from like the guy has the guy had a nickname. Huh. Oh, I remembered. Like the evil genius Broderick Chavez, also another
Yeah, Broderick
smart guy.
Chavez. Yeah. Yeah, Alex Keegan's very interesting. I see he really likes molecular biology. Like that's his whole approach to things. I find that very interesting and admirable. I prefer more of the clinical aspects, but to each their own.
So should bodybuilders also, can they use exogenous estrogen in order
Well,
to
I've seen it.
protect their brain? And also
I
like
mean,
cardiovascular, cardiorenal,
yeah,
etc. Very, very.
but a disclaimer: do not use what's it, transdermal estrogen if you are looking to improve your estrogen. It doesn't seem to be as protective as oral estrogen. There are a few studies I came across which suggested that if you are looking for the cardiovascular benefits of estrogen, transdermal estrogen seems to have nil effect.
I, I
So,
actually I actually trying to recall memories, research I've seen, and I remember that I barely on top of my mind. See, transdermal estrogen was less effective for uh, improving your lipid profile, but actually
yeah,
it had much less risk for deep vein thrombosis, etc.
yeah,
So they
yeah,
some of the studies found that it was actually more protective than
more protective in terms of,
sublingual estradiol or oral. Like when you take oral or sublingual, the oral is probably the worst way to apply estrogen because it seems to skew ratio of estrogen to estradiol. Most of the drug you swallow seems to convert it to estrogen, and you have estrogen spike in your blood values right after you ingest it. But sublingual seems to somewhere between the transdermal and oral. So
yeah,
my take would be like avoiding the oral. My take would be that.
yeah, I suppose you could, but I don't know. I've just transdermal estrogen. We don't use that in clinical practice because it seems to. Well, I mean, in terms of actually replacing your hormone, it seems to do that. However, it seems to be less effective, especially in terms of contraceptive abilities. And perhaps that's why it doesn't cause as high rates of deep vein thrombosis because you're not really getting much estrogen, if at any at all. But I don't know.
Yeah, I was trying to find research that showed like scrotal application of
Oh
estrogen cream
yeah,
for especially for transgender individuals. But I found that there are some transgender individuals try estrogen patches on scrotum to get
oh,
uh, best bang for their buck.
I mean, I mean,
As with
it sounds
testosterone
it.
cream, right? It you can get much higher blood, serum concentration with applying to areas that has very thin skin, like inside your wrists or scrotal area.
Yeah, I mean, yeah, the scrotal application sounds interesting. I never heard of that, but I'm not surprised.
Getting rid of the patch must be painful, I suppose.
Yeah, free wax each time. Oh,
Yeah. Have you had any patient who used like exogenous estrogen when using AAS?
no, never. I mean, I thought you were going to say exogenous estrogen, and I can tell you I've injected a lot of women with Depo-Provera, which is just
So
the injectable form.
it's quite uncommon in Turkey to find like injectable estrogen. It's either
Really?
oral or they prescribe oral contraceptive like ethinyl estradiol or 17 beta Estradiol with combination of another progestin or patches.
Yeah, usually the
There are
combined.
some vaginal creams, but I suppose their concentration is very weak and they only work for like the endometrial tissue or like vagina for
Oh,
like
well,
for dry vagina symptoms.
we use it for vaginal atrophy, which occurs in menopause, if
Yeah.
they're experiencing that, because it's quite common. So that's what we use the creams for. But obviously, I don't know. That's the only time I've ever prescribed it. But yeah, the everyone here is either on the injection or combined oral contraceptive, COCP. The injectable, though, is notorious for its weight gain. These,
Are you talking about injectable contraceptive progestins or injectable 17 beta estradiol?
it's just injectable Depo-Provera or
So
Depo-Provera,
estradiol. So basically, I'm
essentially.
not familiar with the with the name, so I'm sorry.
Let me just check. It is estradiol from what I can recall.
Is it Valerate? It seems to be the most
Uh,
common
no, no,
ester.
sorry, it's medroxyprogesterone acetate.
Oh, that's progesterone. That's notorious for weight gains. Like you can, it's not uncommon for like high school teenagers when a high school teenager starts like injectable progestin alone, they seem to become a water buffalo in 1 year. Like they
Yep.
gain like 20 pounds in 1 year.
Yeah, I feel really bad for the because I've seen it. Like I've seen just like normal sized individuals become Michelin men when they come back into the clinic for their next shot in 3 months. But no, I've never seen it
Is
in.
there any like niche, so can be called niche oral contraceptive that are that is being used in only South Africa? Like,
Not that I know of. I although I'm unsure what they use, but we use something called the oral one is called triphasal, which is the combined oral contraceptive, which is the similar formula to Yasmin, or that the common oral
yeah.
contraceptive that you get everywhere from Bayer's. But yeah, there's no specific one. It's just we use the injectable one a lot due to compliance issues. A lot of patients don't like taking meds daily. So, you want to prevent unwanted pregnancy. So they just come every 3 months
Is there
for
single?
their.
Is there any single phasic birth control oral contraceptive in South Africa
There,
that
yeah,
females use
there are.
continuously? Like,
Yeah, there always are, but if you because like a lot of people get quite unbearable side effects from the triphasic um, OCP, but from there they usually go into something like Diana. Let me check.
mhm. Dianogest,
Um,
is it like Dianogest for?
yeah, I think that's the name, Diana. Yeah, which is just the estradiol, the ethyl estradiol. That's yeah. I A few people go into that just because of the. A lot of people can't seem to tolerate progestin.
In Turkey, there seems to be like one or two single phasic oral contraceptive for continuous use. Other than that, they either have two phase or three phasic.
Which do they use in Turkey?
A single phasic is like there were only two, if if I remember correctly, and the most commonly prescribed was one was levonorgestrel.
Okay, yeah. What the okay, yeah, we usually use that as the emergency contraceptive.
Oh yeah, yeah. We also have that
The
too. And also, I didn't know that there was a like emergency option, that something so-called emergency option in literature. I found that like ingesting five level Nergestrel pills have somewhat similar efficacy to single pill. Like we
the
call them the day after pill. I don't know
yeah,
if
the day after pill, that's the one. Yeah, it's
yeah.
like extremely high potency, so you have to prescribe it with metoclopramide, which is an antiemetic, so they don't feel nauseous afterwards. But yeah, that's pretty. The combo of the two are quite not.
Do
I
they
wouldn't
have
say
any
common, but
thrombotic events? Like, is thrombotic events common after ingesting the
um,
emergency pills? Like,
it
since they
seems
ingest a very high dose.
it seems that that single bolus in like ingestion, it seems to be more in related to duration from what I think, just because it's just a single spike. So if you look at like the medium concentration, it's not that high, and the duration is also quite short. So I'd assume not. I've never seen it occur.
We talk about estrogen aromatization, and also, I think that we also mention Dianabol again for like estrogen purposes. Like, people seem to dream about the so-called golden era, but they don't realize that in golden era they didn't use, in that time in United States, they didn't prescribe testosterone. They prescribed
Yeah,
either Deca, nandrolone deconiate, or Seba's Dianabols. That was pretty
yeah.
much all.
Yeah, well, I mean, then there's some indication that they may have used what you call it, primobolan or methanolone, but that
Yeah,
wasn't as common in nicotine.
Arnold liked the Primobolan combination of Primobol and Dianabol, and Mansour brothers favored the Dianabol and Nandrolone, because it makes sense. Like, Mansour liked to use high intensity training. Like, the
Yeah,
Deca
exactly.
component makes sense because of that.
Yeah, I'm actually I just finished reading his book on the high intensity training protocols. Quite interesting. Like it seems it's like barely any volume at all. It's like 3 hours a week of working out, and but I mean, obviously the intensity is quite high, but
Yeah,
it's
I would like
you'd be
to
surprised.
see muscle biopsies of people who got better results with high intensity training. I really, I wouldn't be surprised to see that people uh, who benefited from higher intensity training, I wouldn't be surprised to see them to have a very high type 2 fibers, because, as we know, type 2 people
Exactly.
who have type 2 fibers don't tolerate high volume, and also when they use like higher when they exercise in higher repetitions, they will tell you that they don't feel anything above 10 reps. Like, they will
Yeah,
say that they have no pound, it felt terrible. They don't feel anything.
yeah. It's surprised, just anecdotal
Yeah.
experience. I've experienced both. So far, more on the I have more type 2, I would say, nowadays, since I did decrease my volume quite substantially, not on purpose, but just due to me being busy and wanting to get the hell out of the gym as soon as possible. So, yeah, it's so I've experienced both, I would say.
Is there any reason for bodybuilders to use Dianabol nowadays, since we have testosterone and oral oral and transdermal estradiol?
I
Is,
I don't
should
know.
they
Like
avoid
that's
it?
I mean, obviously, it should be avoided, but it's still very popular just because it's known to be the mass builder. But they don't realize that a lot of the mass is quite temporary and coming from that estradiol. So they might as well just take test and ingest a lot of pills.
Yeah.
Uh,
Only the only time I found like Dianabol is very effective and have a meaningful and strategically beneficial effect is when they have really low estrogen. Because we know
yeah,
that you can crash your estrogen very easy, very quick. But raising estrogen as
yeah,
quick as it's falling down is not it's not easy. It takes time.
yeah. So in like those cases, which are quite common because people overthink their AI use and use way too many. In those situations, I just tell them to make sure they have HCG on hand because that seems to help quite quickly with the estrogen. Well, I would say they'd have to go above 500 IUs, and then it seems to
500 high use per week or per
just
day.
like in one injection.
Uh-huh.
Especially, it definitely helps with aromazine overdose. I found this isn't based on research, just by the way. It's just from
Yes.
experience. Because I don't know if it's proven or theoretical or I mean hypothetical, but um, does HCG, the estrogen caused by that, seems to be um, resistant, or well, the aromatization seems to be in the testicles, and aromazine doesn't seem to reach the testicles, or something like that. That was
It's very
essentially
conflicting because most of the aromatization occurs on the
occurs
peripheral
in the
tissues. Like,
adipose. Uh,
yeah, was like 20% in intratesticular aromatization and the rest was in peripheral. What is the
yeah,
ratio like that? Is it
yeah, it is. It is that, but I was like, I was just trying to justify why it seemed to work so well in that, but I don't know.
yeah.
But yeah, essentially that's how it goes.
Can
But yeah,
bodybuilders or recreational lifters on cycle can benefit from also HCG since they will uh, they'll like they will keep synthesizing their own cholesterol backbone hormones like progesterone and allopregnanolone,
yeah,
like many neuroprotective uh, hormones, so they can synthesize that. Steroidogenesis can still occur in the testes. So
yeah, yeah.
would using like uh, that pre- it is called pregnal in Turkey. Like, would they
Yeah,
benefit from using
pregnant. Yeah,
pregnal on cycle,
I think so. I think
independent of testosterone and estrogen? Like we have many
yeah,
hormones besides
yeah,
estrogen and testosterone.
yeah. I mean, I'd be interested to hear what you think, but essentially, I always think it's pertinent, especially in cruising when you want to control or try correct everything, to have use something like pregnal as a backbone along with derivatives of your neurosteroids like DHEA and pregnenolone. And that seems to just that seems to keep, well, I mean, in my head that seems to be proper HRT, just because I mean it makes sense, but I'd be interested to know what
It's a
you
bit
think.
tricky to address. You can tell that someone who has depends on if whether it is a male or female, but you can easily say that they have low estrogen or low testosterone symptoms, but you can't pinpoint the deficiency in
Yeah,
DHE
yeah,
or pregnenolone. You can't easily say that, oh, this person has pregnenolone deficiency.
yeah,
Like
yeah,
you
exactly.
you just you keep the basics. Like if they're deficient in testosterone, you can replace it with either exogenous testosterone or HCG or whatever they need for that
Hmm.
time. Their strategies might change after like 6 months to a year after the
Yeah.
initial therapy. But after that, someone as a doctor, for example, you can easily check their symptoms or whether they have depressive symptoms, whether it had improved or not, so they can try like low dose pregnenolone or low dose DHEA with trial and error method to see whether it has an effect or not. So I would say that
Yeah.
that's the smartest way to design a properly TRT or HRT
Yeah.
protocol.
Yeah. Yeah. Rather preventative than suddenly you experience some
Yeah.
symptom and have no clue what it is. Rather just,
But I would say that
yeah.
pregnenolone is a bit more neuroprotective because of it's the
Yeah.
mother of the all hormones, and it has like allopregnanolone seems to have a special place in brain tissue. So
Yeah.
I would say pregnenolone for brain health is a bit more important than DHEA.
Yeah.
That will be my take.
Yeah.
But it differs person
And
to person. You know, you might prescribe pregnenolone to a person, it might improve drastically their cognitive and depressive symptoms, but they might somehow, some people like anomalies. There are some anomalies, as you know, as people know. Some people just might get super high cortisol levels from pregnenolone. It is high. Is it highly likely? No, but it's a concern. Like maybe like there is a 5% chance to them to get like high cortisol levels. Who knows? Like a slow titration of those is probably the best way to see whether
yeah.
they have high cortisol, high uh, sodium retention, etc.
Yeah. Yeah, that's the with DHEA, it seems to help with people who complain about fatigue on cycle. It seems to aid with that. If it's like, if it is, I just tell them give it a try. It's see if it helps, and it
Would you
has
tell them
helped
to give it a
more.
try for DHEA or pregnenolone?
For DHEA, oh, they could try both theoretically, but I found that pregnenolone, like when people, I don't know if you've ever seen, it's quite common when people get brain fog on cycle. It's I yeah, I don't know if you've come across people who've
Yeah.
had
At
it,
the
but
same time,
there's brain
when
fog.
they use HCG, they might need less pregnenolone, less
Yeah,
DHEA. It's quite
yeah,
complicated.
yeah. Yeah, it's just like if that happens, I kind of just want them to cover all bases at bases at once and see.
Have you seen any patient who had like high cortisol levels or high sodium retention because of pregnenolone?
Personally, no. Um, no. Sorry, I was thinking about there are conditions in babies, newborn babies, where they have salt wasting and stuff, but that's more in relation to things like DHEA and whatnot. But yeah, no, I've never seen that. Oh, what's it? Adrenal atrophy.
Also, let's talk. We in the previous episode of the podcast, we talk a lot of calcium channel blocker, antihypertensives in general, like diuretics to calcium channel blockers, ACE inhibitors, ARBs, etc. But I want to address the importance of the newer generation calcium channel blockers. It is especially important for the black individuals because we know that black individuals are not as responsive as white individuals to ARB or ACE inhibitor administration for hypertension.
Yeah, yeah,
And if I, as I recall, it was caused by like sodium, like they are not as sensitive to sodium as sensitive as.
Well, yeah, I don't know if
white
that's the
individuals.
cause, but it's like a hypothesis because they seem to be more sensitive to sodium intake than
Uh-huh.
white or Caucasian individuals.
I see. As we've said, like calcium channel blockers seem to primarily dilate the vasodilator effect is primarily on preglomerular vasculature, like preglomerular arteriole. So, uh, so newer generation the older generation calcium channel blockers primarily work on like dilating the afferent arteriole, but newer generation calcium channel blockers seem to dilate uh, afferent preglomerular to postglomerular arterioles at a roughly 1-to-1 ratio. So I thought that that might be a very beneficial for black individuals who have uh, diabetic kidney disease. So they might use calcium channel blockers for decreasing their blood pressure while not increasing the hydrostatic pressure in glomerulars. So that was my thought initially. So what do you think about, what's your opinion on newer generation calcium channel blockers? Are they promising for black individuals, especially who have kidney disease?
For diabetic kidney disease,
Yeah.
I'm not too sure. Um, yeah, I wouldn't be too sure about that, but yeah, in terms of just overall controlling hypertension and things like that, they're very beneficial and are always used. Um, but in terms of kidney health and things, I don't know too much about that. But yeah.
To my knowledge, the newer generation drugs are only like marketed in Japan, or it's like couple of them. Like
Yeah,
Jap- J-
we
Jap-
we yeah,
Japan seems to be a niche market for anything from like older androgens, the progestins, to like calcium channel
yeah.
blockers. They have a very niche market.
Yeah, no, we'd be South Africa would be the last place you'd find a medication.
Yeah, they still use like drugs like mastron, like
Do they?
not structurally similar to mastron, but they still use like androgen for breast cancer. Like it's super
They still use
interesting to see.
androgens
Yeah,
in breast. Oh,
I suppose
that's
addition to
interesting.
SERMs.
Yeah, I mean, I wouldn't. Yeah, interesting. Yeah,
It's probably better than methyl testosterone, I suppose. Like it would make a female to transform to male like in 6 months.
yeah. But I'm curious as to why they still require them. I mean, we have pretty good control with just SERMs and aromatase inhibitors, and hormone receptor positive breast cancer seems to be one of the better ones to get. I mean, no breast cancer would be best, but hormone receptor positive seems pretty chilled.
Like maybe like addressing like multiple factors uh, might be a better way. Like we didn't recently, till like early 2000s, we didn't actually know the secondary beneficial effects of uh, ARBs. Like they have antagonistic properties, we know that, but they also have, most of them seem to have inverse agonism, like they seem to downregulate the basal, like uh, resting AT1 receptor. They seem to downregulate that also. Like we know that like stretch mediated AT1 simulation is a thing. Like pressure overload seem to affect uh, pathologic heart remodeling independent of angiotensin 2. So that's the thing. So that might be the case. A similar case might be going for the androgen therapy in Japan for female
Hmm.
breast cancer. So, uh, who knows?
Yeah, I'd be interested
Yeah.
because I used to work for quite like 6 months in a breast clinic, so seen a lot of interesting things.
Have you seen very neglected patients who just didn't care their breast cancer for a year, so it
That was pretty much all of the patients. They had a lump, but they didn't think it was a problem until they came to me, and the breast did not look like a breast anymore.
was there any patient who like knew that she had cancer but didn't care for 6 months and came to clinic? Was there
I mean,
patients Were there patients like
all of
that?
the patients think they have cancer, even though most of them are just coming in with fibroadenomas, which are like these benign lumps. But I assume
Are there
like
like
when
lipoma? Like are they like non-dangerous
they're not
tissues?
lipomas, they're like actual glandular tissue, but
Uh-huh.
yeah, they feel the same as a lipoma in the breast would feel, but lipomas in the breast are not that common. But yeah, fibroadenomas very common, and so is fibrocystic change, which scares a lot of people. But yeah, a lot of women, I mean, I'm sure they must have known they had breast cancer when their breast did not look like a breast anymore. It was like, it kind of just looks like a big ulcer sometimes.
So, I recently did a video about like androgen family tree, like anabolic family tree,
Yeah,
like to make people to get it much easier. Like people seem to
yeah, I
like
saw.
very complicate things. Like having three major families seems to make make things much easier to understand for average for an
Yeah,
average Joe. But so there is there's I would say that till like 5 years ago, people 5 to 10 years ago, people seemed to think like DHT derivatives are the same as DHT, so they have the same androgenicity, same
yes,
hair
yeah.
loss, same vocal cord changes, or same
Yes, I was literally
hair
having this
growth.
argument with someone the other day on Reddit. They were talking about anavar and hair loss, and they're like, "No, you'll get extreme hair loss."
But I would say that there are some. So we lost your connection, I guess. Yes, we were talking about your discussion on Reddit.
Yeah, yeah, it was just essentially about anavar, and then I had to use the example of Winstrol, which, does cause hair loss, but it has 22% of the binding affinity to the AR receptors in the scalp than DHT does, even though it is a DHT derivative. So it's kind of, you can't just base everything off its backbone structure. There were alterations made to make it more selective.
Yeah, some douchebag can claim that like those DHT derivatives can activate the vitamin D receptor too because they look similar, right? According to that logic.
Yeah. Well, I actually have an interesting question or topic I was going to come up with because I've been doing research on it for the longest time, but I don't know if it's controversial, but it goes against what a lot of people seem to be talking about. And this is in regards to anavar or xandrolone and its metabolism. Everyone keeps saying it's mainly metabolized by the kidney, but they're not. And when it even says it on Wikipedia, but when I started
I only
investigating this,
found one enzyme that is associated with uh, kidney metabolization and nothing much else.
yeah, it's just like in the study everyone references, they weren't talking about metabolism, they were talking about excretion. Yeah, anavar is excreted by the kidneys, but does that mean it's metabolized? No, not at all. It's and I don't know. It's a bit of
Uh,
an annoying topic because I've had this
so far,
debate with
my
people.
findings like point that it metabolized much more than any other oral so far, like commonly prescribed or legally or historically prescribed for human use. It's probably it seems to be the most uh, most metabolized drug by kidneys. It seems to be the case, but
Well, I
how
mean,
what
I
is the
would say
percentage
that
of metabolization, right? Is it
I
60% kidney, 40% liver? We don't have
that
like very
yeah,
very supporting
because
data.
like when I think of kidney metabolism, I go back to the lectures I had on morphine and how that was actually shown to be metabolized by the kidneys. And I've struggled to find anything that suggests Dandrolone is metabolized by the kidney. And then every time they mention it in like a literature review, and then I click their source, they keep referring to back to this 1970 paper that just looked at renal excretion of anavar. So I don't, and you don't, it's like if it was metabolized by the kidneys, you would expect more of a urea and electrolyte change on using higher doses of
Yeah.
anavar, but you don't see that.
Yeah, the funny thing is they actually historically they like developed and used couple of androgen molecules for like managing cholesterol, like having a
Yes,
better
I
lipid
saw that.
profile. But Anavar was one of them, but they stopped that because yes, it lowered the total cholesterol count, but it mainly came from HDL reduction. The funny thing is, it
Yeah.
skewed the lipid profile, so they 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 stopped and repurposed it.
I think I actually was reading about that yesterday. I was like, yeah, that was it was a bit entertaining to read that paper. I mean, just because of what we know now, using it to try to treat familial
Yeah.
hypercholesterolemia, that was like quite entertaining.
The the interesting thing that like there is like people there are again like two consensus of thinking about anabolic to androgenic index. Like one consensus think that it's
Yeah.
legit 100% in uh, in humans, and the other consensus think that it has no logic behind it and it has to be abandoned. We have no reason to look at it. It's like a very old research paper, and I think that as it is with most of the cases, the truth is somewhere the between. Like for male,
Yes.
it's somewhat like relevant. They used male rats mostly. In females,
Yes.
it is less relevant with females. The as we know, like androgenicity side effects are not just like prostate growth. Like some of the
Yes. Yes.
steroids seem to uh, like Winstrol, like it has a very good anabolic to androgenic ratio, but in real world, the hype doesn't seem to live up to that.
Hmm.
Winstrol seems to be like one of the, I would say, rogue drug that uh, even doesn't even closely seem it doesn't even seem closely related to its readings. Actually
Yeah.
in real world it's
Interesting.
acts very different. So my uh, point is that for people who ask my opinion, I generally tell them a very basic thing, like compare when they are comparing two androgens. I tell them that compare two androgens that have very similar myotropic agents, like compare primobolan to nandrolone, primobolan to testosterone, like masteron to primobolan, masteron to testosterone, masteron to nandrolone, you, you name it. So when comparing the two, I ask them to multiply the androgenic reading by 2. If
Okay.
you, if they, like for primobolan, right, it has a androgenic reading of 44. I ask them to multiply by 2 and they get 88. If that result is lower than the drug you compare to it, for example, testosterone, it has 100 to 100 ratio, right? I would, I say that them, yes, it's a drug that probably is less androgenic than testosterone. The same goes with the nandrolone. Multiply nandrolone it with 2, I guess it was like 37. It's lower than 100 reading of testosterone. It has lower androgenicity. But things get a bit complicated when you compare primobolan to nandrolone. We know that there are historically using comparing masteron to nandrolone for breast cancer positive females. We see higher androgenicity side effects for nandrolone as opposed to its lower androgenic reading. But also another funny thing is in one of those studies it's shown that 100 milligrams nandrolone was even more androgenic, more masculinizing than 400 milligrams of masteron a week. So nandrolone had higher androgenicity even when they injected females up to 4 times higher doses of masteron. So my take is it's a bit complicated, and I don't recommend females to use nandrolone itself when they introduce androgens for like performance enhancement. I don't recommend females to use like nandrolone in 3-digit milligrams, because we know that nandrolone
definitely not 3 digits.
Yeah, there is a reason, like because nandrolone when nandrolone gets 5-alpha reduced, it gets less androgenic, and you can 5-alpha reduce your androgens up to a point.
Yeah.
So they might get less 5-alpha reduction, so it might mean more side effects, more masculinization, more hair loss or facial hair growth or clit growth. I know that some people are willing to do that, but it's a side effect still.
Yeah.
But I would say that I would say there is an unpredictability when comparing primobolan to masteron and comparing masteron to nandrolone. Some people seem to get less side effect with nandrolone, less masculinization. Some people seem to get less masculinization with masteron compared to primobolan. Some people seem to get more masculinization with primobolan. But you almost cannot find, maybe you can find like 1 or 2 anomaly that will show like higher androgenic effects with primobolan compared to testosterone. But when you compare those all to testosterone, those all have lower androgenicity over 95% of the time in real world. But Winstrol seems to be like one of the different drugs that their readings don't matter whatsoever. Like especially with oxandrolone, they seem to often fake it with Winstrol. So females voice, when they realize that they got fake oxandrolone, it's pretty much very late, because the only reason they get is their voice deepening. In my experience.
Yeah, because it sounds like they have like a cold, and then like it just doesn't go away. They have this raspy voice.
Yeah. Also, what I found that like the drugs that like change the skin texture, like halotestin, it's the testosterone derivative, but it pretty much seemed to act like a DHT, like it makes your skin texture look like masculine, like less like 5% difference
Yeah.
in skin texture, like very hard, like very like paper thin skin, but hard
Yeah.
look comes from the like halo test, and we know that Winstrol does too. Also Superdrol, like it's somewhere like inflates the muscles like glycogen content. It's like
Yeah.
it almost
Well, yeah,
volumizes
Winstrol.
and makes your skin texture look masculine a bit. It does it does the two at the same time. But what I found that especially with Brazilian chicks, they seem to most of the time they use Winstrol, and most of them actually have much masculine looking skin, and it won't go away for a reason. When you look at the
Okay.
oxandrolone, legit oxandrolone users, their skin like texture changes barely and returns to baseline if they are like caring, if they care about their feminine look, of course. But
Yeah.
For some reason, Brazilian females prefer like Winstrol because of its reading. But I gotta agree, it's more selective than testosterone, yes. But the drugs that change the skin structure seems to be permanent because of the uh, total length of their use. Like it might sound really silly, but in contest prep, in like 4 weeks before contest, the skin texture changes seem to be much better when you use like skin texture changing drugs for longer. Like using 4 weeks uh, of Winstrol prior to stage against versus two 2 weeks before the stage. And I would say that with four with 4 weeks before the stage approach, you get much better skin changes, and it seems like some of those changes are permanent in those cases because of how long they use. Like it, especially I say I say that especially for the Brazilian females who use
Yeah.
Winstrol. It
Well,
seems
I
I
mean,
legitimately like their skins have like somewhat like
yeah.
men's like in their forearms they have some of men have like men, I would say manly freckles like manly hairs like
Yeah.
really
Yeah. Yeah.
really thick hard
Yeah.
skin. The Brazilian
I,
females who use Winstrol seem to have that type of forearm, almost like 60 to 70% of them if they used
I
it
think
legitimately,
it's related to the
even when they don't have like facial hair, like uh, hair loss. But at the same time, we know that females are expert at hiding those those things like facial hair,
yeah.
they like
Yeah. Yeah.
acne, etc.
Yeah, I think it's related to the procollagenase activity of Winstrol. It's something to do with that. The fact that it stimulates procollagenase, especially in the skin and the synovial membranes, which is interesting, an interesting effect.
It's like a very different drug because Winstrol like is notorious for giving people like uh, dry joints, but we have animal studies show that when you inject them with intrathecal Winstrol, it
Yeah, it
actually like
helps.
it helps with it. So the administration route changes the drug behavior completely.
Yeah, and I would say the whole dry joint thing, that's never been reported in even patients taking it for 40 years with hereditary angioedema. They never reported any myalgia or arthralgia associated with Winstrol. I think it just someone mentioned they had dry joints with Winstrol, but probably because they're using diuretics and prepping for a competition, so their joints are, a bit more delicate when they're so lean, and then they just said, "Oh, it's Winstrol," and then someone else had the same thing and said, "Oh, it's Winstrol." I that's what I'm guessing.
My guess is it's, as always, multifactorial. The primary reason is, I would say, probably antiglucocorticoid effect. Seems to, because there were back in the day there were like pro-hormones designed by Patrick Arnold, the famous like
Yeah.
Belko behind the Belko
Yeah.
scandal.
Oh yeah,
He
the
he
whole that
yeah,
the
he also
clear that
designed and made drugs like because of him. Some like antiglucocorticoid some pro hormones that had antiglucocorticoid effect entered the market just because of that. He was the first guy. But
with
the most people complained with like joint aches, like arthralgia. Many
yeah,
people, while they while while it made their like uh, stomach much tighter, much flat. They seem to lose like their visceral fat much easier. They didn't hold water weight, or they lost the water weight they previously held. But it seemed to like uh, produce arthralgia or
would well in that case then I'm just like hypothesizing why wouldn't something like trembolone or exandrolone, which are also
yeah,
anti-glucocorticoid or glucocorticoid receptor antagonists, have the similar effect?
yeah. Uh, I was going to mention that also. It's very interesting. Like
Yeah,
maybe there are things that we still don't know.
yeah. I mean, it's there's still so many things left to be discovered, I suppose.
Yeah, also probably like estrogen plays a role in like dry joint
Ah,
complaints
true.
because we it's not a substrate for aromatase enzyme, so it somewhat tries to aromatase, but it cannot. But it also at the same time causes your testosterone to aromatase even less, and your
Yeah,
testosterone to
yeah,
estrogen ratio get a bit skewed. So you
yeah,
get less like uh, less stimulatory effects of estrogen on, for example, breast tissue, etc. So there are multiple reasons, but the it's probably my least favorite. Almost, I would say I hate menstrual because probably the primary reason is I already have many many injuries, many aching joints, but I'm also
yeah,
cautious because of that. It make me cautious for making at least to avoid injuries, unnecessary injuries, unnecessary stresses.
yeah.
But it seems to also menstrual like DHT derivatives are, we know that particularly are very good for skill acquisition.
Yes, yeah,
But the DHT with mastrone, you can tear your quads and pecs, especially if you're in like hypocaloric diet in contest prep.
mm,
When you're dieting
yeah,
with very with in a contest prep with very high dose mastrone, it's not uncommon to see torn pecs, biceps tendons, and quads
yeah,
because of the skill acquisition. They can easily uh, progressively overload, like they can add like 40 kilos easily to their
yeah,
squat when they're in contest prep. I mean contest prep.
yeah,
So one of the reason of that's probably one of the reason that's probably goes for the minstrel to the skill acquisition part. But in
yeah,
particularly, it increases the tendon stiffness. Like you your tendon stiffness like helps with like elastic movements or sprinting, jumping, like very like uh, the sports that you change directions very much very often. The sports that you change directions very often, you benefit from tendon stiffness. Actually, it helps you to jump higher, run faster, but at the same time, it's make you susceptible to uh, muscle injuries because your muscles
Yeah.
tend to get that tension much quicker. So you can again tear your pecs or biceps tendon easier when you're on winstrol. Again, it's multifactorial.
Yeah.
They
Yeah.
probably,
Very interesting.
I would say that the primary reason why people like still use winstrol in contest prep is probably estrogen management, skin texture changes, and third reason I'm thinking of, appetite. It might sound silly, but
Yeah.
it's like 17 alpha alkylated drugs in general curb your appetite. They can
Yeah.
literally do the same with anadrol, with till the 4 weeks prior to stage, and they can still curb their appetite and they can still retain glycogen, that fullness, etc. So
Yes.
there is no thing as like contest prep drug, actually.
Yeah, exactly.
So do you have anything to add?
No, very interesting what you're saying. And I definitely agree with everything. It being multifactorial, and you went over factors that could affect it. And I think that's quite thorough in terms of why something like winstrol could cause joint damage or pain or injury. So yeah, very interesting.
So here comes the fun part that I didn't mention in the beginning of the recording. What is your favorite, I would say, what is your favorite androgen that you would pick if you had one choice?
Testosterone.
Okay.
And yourself?
Well, mine would probably the Primobolan, not itself, with
Oh yeah, but
with
okay.
exogenous estrogen. I would say it's probably the
Yeah,
least harmful steroid for the lipid profile when you combine it to 17
yeah,
beta estradiol.
yeah, yeah,
So,
yeah.
what
I
would be
agree
your
with that.
favorite, like I would say, niche androgen to see much newer research, to see get it
Newer.
researched?
Um, Personally, I am very interested in Trestolone and Ment at the moment, and I'd like to see more research, especially in patients who need or not, hypogonadal
Yeah,
patients. And I want to see more in actual humans, seeing like what their markers do, long-term studies, and yeah, it's just there's not much to go off at the
yeah.
moment,
Brain
and
health is a
just
concern, I
understand.
would say.
Yeah.
So, so actually, I meant the like forgotten like steroids in the past, or like being
Oh,
like
forgotten
repurposed as
steroids.
pro hormones
Yes.
and entered the market, that I would say maybe like the non 17 alpha alkylated version of the newer pro hormones that entered the market, or like disappeared from the market. I would say, what's your niche forgotten
Um,
favorite forgotten androgen?
I mean, what I found interesting, I don't know if I'd want it because I haven't done too much research on it, but I wanted them to be more development, and that was the precursor to S23, the SARM S23. It was called C6, and it wasn't as bioavailable, but it seemed to be less suppressive and quite anabolic. And I'd just like to see more research in that, but they abandoned it because it wasn't, they wanted to develop S23 as one of the, which it probably is one of the most suppressive compounds. Um, so that's why they replaced C6 with S23, but
Yeah,
C6 seemed to be more favorable in terms of health markers and fertility. And it seemed to be like S23, except the side effects were not as severe. And I just know that from people who have used S23, they love it. but that's for anabolic abilities. But yeah, and yourself?
Well, mine is actually, I also recently found that Dan Duchesne mentioned it, like that would be his like favorite steroid, like stembolone. Like it's like a sister drug of primobolan and mastron. It has a methyl on the second position instead of one, but it has still the one one ene, double bond between the first and second position. It's a DHT derivative.
Okay. Well, I mean, if it's a mixture of primo and masteron, that sounds quite interesting.
It also like you can count it as a like the hydroboldanone derivative in a sense because only difference between it and the hydroboldanone is methyl group at second position, second 2 alpha methyl group. So uh,
I have
people who
I'm doing a
used
bit of
seem to
interesting.
report very uh, uh, most people seem to report painful injections. I suppose
With
it's not
standalone.
as yes, I suppose it's not as painful as DHB, which is notorious for giving PIP,
Yeah, with that
but
and
it
injectable
it seems like
Winstrol, but
it is somewhere. Yeah, it seems like it is somewhere between the two for like injection pain. I would like to see more research, but
yeah,
for some reason, since 90s we haven't had really like we haven't come up with new androgen. Like
yeah, it's kind
probably,
of been dry the past few years, the past decade.
yep. As far as I know, the primary reason is probably because the classification of anabolics in United States
Mm,
changed so much of they were the they were leading the research field in androgen United States mostly.
yeah, yeah,
And
yeah.
also
It's
probably as far as I know, like Joe Biden played a big role on like law a passing of law in United States regarding steroids. So it made quite harder to research or develop newer drugs in United States as far as I know.
the guy.
That's
The guy was Joe Biden's Hayden. He's not Myron our gains.
yes. And also Broderick Chavez wishes him to die of prostate and penile cancer, but slowly.
A bit of an odd
He
death
hates him
wish,
really.
but
That, but just
yeah.
because of that reason, if I remember correctly. No, he's known as like as the drug guy. He like
Yeah,
spent his years with drugs. Like he has like 30 something years experience, and that's
yeah. I mean, odd death wish, but
yeah. We need more research with stambolum, right? They stop for some reason they stopped, but we have methyl stambolum prohormone still was still on the market till like 2015, I guess. Somewhat,
really,
yeah, methylated version of methyl stambolum, which is which seem to be like some of the most toxic prohormones, like among the most toxic prohormones. Like the most toxic ones were probably the superdural methyl 1 testosterone and methylthrinolone.
yep,
With no question, methylthrinolone is the most toxic, but the ones that were at least historically marketed as prohormones among those, I would say that methyl 1 test was probably the most toxic prohormone that was ever marketed.
yeah. Pro hormones are the best way to get yourself into hospital.
Yeah, get jaundice and kidney disease as soon as possible. Maybe TikTok kids might hype a new challenge called like get to IR ASAP with prohormones.
Which one of us can get jaundice first?
It won't take much, like they plan to market like methyl trinolone, metal trembolone in microgram doses, less than milligram. So I would expect permanent damage after one scoop of methyl trinolone.
That would be interesting to see, though.
Yeah, I don't wish to see someone like that, but if I would like to, but if there were a case like that, I would like to talk with him or like study him. I would like to see the extent of permanent damage, like eyes to kidneys to heart to even lungs.
I mean, yeah, it would be an
Yeah.
interesting case.
Okay, so that's end of the podcast, I guess. Do you have any question or like anything to add?
No, but thank you for having me
Oh, thank you.
on your
Thank
podcast.